So if you were about to give a suggestion, let's say to a colleague of you, let's imagine a doctor in an hospital that would like to introduce AI solution um, in his or her daily practice and so on. For sure, this person, I think, is going to find somehow some resistance or some challenges also uh, to show to deal with. And what would be, let's say, in your opinion, in your experiences, the challenges that a physician is going to encounter in adopting new AI solution, and what would be your recommendation to overcome the challenges to the adoption of AI?
Great. So definitely, I think one, there is a generational divide, and we do see that maybe one of the older physicians may have a little bit more difficulty getting used to it versus the younger folks. However, said that, medicine is the same, and I've seen that every single year there is a new software being introduced, and whether you're young and old, you're able to aptly use it. So that's not a problem. However, one major concern that everybody is looking to alleviate and work on is accuracy and reliability of any AI system. And of course, they can be only as good as the data that is fed into them. And there's always a risk for bias in this data that can lead to skewed outcomes. So these are some challenges. Another challenge is the learning curve associated with some of these new technologies and how to actually fit this into your medical flow. It requires time, it may require a little bit of education, but of course, the major concern that happens is that AI supports and does provide discernible value, that it is saving time, it is saving money, and of course, it is improving patient outcomes. And then it also actually enhances your human element in healthcare. That is fairly important. So we need to balance technological advancement with compassionate patient care. And one thing I would suggest my colleagues in this is, for example, the way I am currently using ChatGPT or similar or Bard or Google for this matter is, for example, there's a skin lesion that comes in. Anybody, human AI, is able to detect in lesions that are very typical. However, when it comes to something that is very obscure, that you may suggest that, okay, hey, you may need a biopsy or something similar, or you definitely need more in-depth investigations to figure that lesion out. What I've been using it for at this purpose is, okay, hey, this is the lesion. Can you give me a differential? Okay, yeah, that makes sense. I should think about these.
That's powerful.
This line a little bit more. So since I don't want to miss anything, hey, can you give me a list of potential tests that I may be doing? Then I pick and choose and select based on my understanding of what the patient needs. And instead of maybe going for some other source or opening up my dermatology textbook or going online to a portal, quickly I do this at bedside, and the things are fairly quick and fairly straightforward. The other thing that people can do is you have a procedure. You conducted a procedure, and you can give it, hey, this is the procedure. For example, this is a central line insertion, but put in a caveat of, okay, it took us 2 tries, however, no bleeding, positioning was fine, and you add that into your prompt that you're giving it ChatGPT, and it will give you a very solid, quick procedure note, and you can plug that in, making sure, of course, it did it properly and inserted your caveats that you put into the procedure, or an NG tube or whatever. I mean, I don't do large surgeries, minimally invasive and procedures at bedside, but so this has helped me, and this can help anyone. It could save me probably 3-4 minutes of time doing a dictation for these procedure notes, while I'm just able to do this quickly through AI means. So yeah, definitely there are so many ways, and people should be looking to apply this, and more utilities will be coming into the picture, and hopefully, I hope very soon, and tested. One thing I want to suggest is that people talk about that accuracy and real results. However, it could be that data is only useful for one hospital. Now, a different hospital with a different medical setting, with a different patient population, with different services within the hospital, that AI that was validated someplace else may not be useful in this hospital. It could be a tertiary center, may be different from a rural area medical center, or an outreach hospital, or a hospital that's that is not as well staffed, does not have the right services. So there has to be a lot of adjustment, a lot of tailoring, at least initially. But I'm sure there are ways to do this more efficiently. However, one place where AI has worked does not mean it will work in the hospital right next door. So I just want to throw that out there. That is also one of the challenges in implementing AI. It will have to be, initially at least, a tailored approach. Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.